I was a Paul Tsongas supporter. I was a Ross Perot supporter. I worked for Leader Leave in the 90s. There was an early deficit reduction group because that was a main concern of mine. But it seems the facts have changed since the early 90s. I don't see it very reflected well in these presentations. The $56 trillion number of unfunded liabilities, William Greider says that's based on numerous artful fallacies, chief of which is conflating Social Security with other issues when Social Security is in fact largely structurally sound. Paul Krugman and others will tell you that we'll pay full benefits out to the year 2049, and if you want it's a minor tweak to solve the problem beyond that. You mentioned healthcare. I know you're mentioning healthcare, but the Pete Peterson Foundation, which is funding all this, has a $1 million ad campaign attacking Social Security and Medicare. But as Ms. Sawhill says, Medicare is not the problem. You have scarring healthcare costs across the whole system. Economist Dean Baker says you could get rid of Medicare and Medicaid. You'll still have this problem because of the larger healthcare crisis. So if this isn't all just a smokescreen to attack Social Security and Medicare, my question is, why isn't the Peterson Foundation running why didn't they run a $1 million ad campaign, for example, against the Bush tax cuts in 2001? We didn't hear very much from the Peterson Foundation then. And why aren't they running ads now about healthcare reform that will control costs?
Let's deal with a little facts first, okay? Please. Because there's a lot of disinformation and misinformation, and we just heard some of it, frankly. First, the Peterson Foundation didn't exist until July of 2008.
With Peterson?
So,
Peterson was involved in the
you want to let me finish? I listen to you, okay? I listen to you. Do you want to let me talk?
I do.
All right. I'm answering your question. The Peterson Foundation didn't exist when the Bush tax cuts were.
Peterson existed.
I personally, yeah, but I was controlled in the United States. I spoke out against them. All right? Pete Peterson didn't support all those tax cuts either, if you go back and look at the record.
I know, but
secondly, the $56.4 trillion comes from the consolidated financial statements of the United States government. They are the official numbers from the consolidated financial statements of the United States government. Thirdly, I was a trustee of Social Security and Medicare from 1990 to 1995. There are no trust funds. It's a fiction.
Well,
there are no trust funds.
By 2049.
There are no trust funds.
Will full benefits be paid by the year 2049 and only 70% of benefits after
2041? If you recognize the fact that the bonds are real, but the trust funds aren't, okay?
The trust funds on the issue, the benefits get paid.
There is no trust fund.
Who cares? The benefits get paid.
Okay, Medicare is underwater $36.4 trillion.
That's a broader health care issue, not a Medicare issue.
No, it is a Medicare issue, as well as a broader health care issue. The underfunding of, I mean, that doesn't count Medicaid, by the way. I mean, I don't, you know, these are facts, okay? You've got Brookings, Heritage, Concord, ourselves. You can go to AEI, you can go to Urban Institute, you can go for the Center for Budget Policy Priorities, which is Bob Greenstein. Nobody's debating these numbers.
I just think Greeks don't agree very much with what you said.
Pardon me?
And Ms. Sawhill's presentation just on broader health care reform, not Medicare. I just heard it 5 minutes ago.
Maybe I can just make a point here, and then Isabel can speak for herself. There is a connection between the way healthcare costs rise and the design of your healthcare system. I come from a country originally 30 years ago, which has a budget and has made decisions and set priorities in the area of healthcare. That had effects on the healthcare system, on the way it's organized and structured. We have a very different system here, which is totally open-ended. On the public programs, and particularly Medicare, as I said, it consists of going to doctors and hospitals, sending the bill in, and paying it. That is completely different from
the budgeted system. Supporting universal health care like England and France and Canada?
Can I just finish? Because
well, I'm not getting a lot of honesty from this
there are other people in the room too, with who may want to have a conversation. But let me just explain something. That on the tax side, we also have an open-ended tax break, where richer people get far more of a tax break to go get more health care. There is a complete connection between the way in which you design the spending side and the tax side on healthcare, and the fact that we have a huge healthcare expansion. They are connected. What we are saying here, which I think every rational person would say, is you've got to deal with the basic incentives and the basic structure, the open-ended tax breaks, the open-ended expenditure type. That's why we have the problem here. And we have to make hard decisions. So don't kid yourself that there's something that you can just sort of fix healthcare like it's sort of on some separate planet. I think, well, you know, and therefore you don't have to deal with the structure of the healthcare system. You have to deal with the structure of the healthcare system to bring healthcare costs down. And one of the biggest parts of that in the entitlement programs is Medicare and Medicaid. The design of those programs leads inexorably to the fact that healthcare costs are going up. They are not disconnected, they are integrated. That's why you have to deal with it that way.
Bill, did you want to?
Let me just say that I worked for Paul Tsongas. I was actually a delegate at the 92 campaign, in the convention. When you say that things have changed, facts have changed, yes, they have. Things are a lot worse now than they were then, because we're several years, almost 2 decades, closer to the baby boomer retirement years, and we haven't done anything either for health care, Medicare, Social Security, whatever you want to look at it. Now we have these enormous budget deficits to boot. So we're in a much worse position than we are now, than we were then. And you know, as far as one can talk about whether, you know, Medicare, Social Security is a bigger priority, we all agree that Medicare is a much bigger problem. We all agree that it's part of a bigger healthcare issue, and that it's a much more difficult problem to fix. But that doesn't mean that you should leave Social Security alone, that there isn't a problem there. The fact that you have one problem that's bigger than another problem doesn't mean that you shouldn't tackle the first one, which is, you know, conceptually easier. Although it's obviously both are politically difficult. So anyway, that's just to be my 2 cents worth from another former Tsongas person.
One last thing on the trust funds, which are fiction, but the bonds aren't. The bonds are real, which is what's more important. Medicare goes to 0 within 10 years. Medicare does not have enough money to pay promised benefits within 10 years. Medicare is already negative cash flow, and the trust fund, if you want to call it a trust fund, it's a trust and government fund, goes to 0 within 10 years.
By the way, I mean, it is important to look at the cash flows, because whether the trust fund, I mean, the trust fund bonds are going to be honored. I don't think there's any question about that. But it's a matter of, you know, the charts that we showed showing these programs as a percentage of the economy shows you what effect they're going to have on the budget and on the economy, which is something totally different from how the government accounts for it. And it's really, you know, so you've got to keep your eye on the bottom line, which is the cash flows and not the trust fund.